Hello there, I am Chimwemwe Kujaliwa and welcome to the program Phenomenal Being. Today at Rainbow we are so excited and of course honored that we are featuring Safari Mbewe, who is the Executive Director of Lighthouse Malawi. Be there. Welcome in our program.
Thank you.
First of all, who is Safari Mbewe?
First of all, let me take this opportunity to thank you for inviting me to Rainbow TV. So Safari Mbewe is a development management professional who comes from Msulu Village, Traditional Authority, Kalembo in Balaka District. I'm a married person. I have a wife, Elizabeth Mbewe, and 3 daughters, Tokozani Mbewe, Pempero Mbewe, and Mayamiko Mbewe. Currently, I am working at Lighthouse Trust as the Executive Director, but I have also been privileged to work with several organizations before, both the local NGOs as well as international NGOs. But one of the places that I would want to mention where I worked was at the Malawi Network of People Living with HIV, where I spent more than 8 years as the Executive Director. Mentioning this because the work that I did there ties in very well with the work that I'm doing here at Lighthouse. In terms of academic qualifications, I'm currently studying for a PhD. PhD in Development Management with the Atlantic International University in the United States of America. But I'm currently a holder of a Master of Science degree in Development Management, which I obtained from the Open University in the United Kingdom in the year 2010. I also have a Bachelor of Science degree in Agriculture from the then Bunda College of Agriculture. It was the constituent college of the University of Malawi. So this is Safari Mbewe.
Interesting. Now we'll get back. We do more on the Lighthouse. So how is work?
I would say generally work at Lighthouse is going on very well. Very exciting. I'm actually very excited to work for Lighthouse. Of course, with a few challenges due to the period that we've been passing through. But we are doing quite well. We are achieving our objectives, and probably later in the program I will be able to mention the specific contributions that we have made towards the national HIV response in this country.
That's where our attention is now in terms of national response, HIV and AIDS. Share with us a brief background on how it has been from where it all started to where we are now.
So the brief background is that Lighthouse, our listeners would be pleased to know that it's a Malawian organization started by fellow Malawians who saw the need to support and serve people living with HIV. So the ones that started Lighthouse were actually officials from the Ministry of Health, Kamuzu Central Hospital, and these were both medical as well as non-medical. And that was around 2001 when the issues of HIV and AIDS were still new. And they saw the need to be supporting people living with HIV. So they were doing that on a voluntary basis. After they knock off from their normal work, they requested a building within the campus where they would meet people living with HIV and provide the services. They also started going into the communities around to support that were the people that had chronic illnesses. So that's how Lighthouse started. And over the time, it has grown into a fully fledged public trust, which is registered under the Trustees Incorporation Act, and that was in the year 2001. So to date, we have grown. We are all over the country. We have almost 1,000 members of staff across the country. So you can imagine how big we are as an institution. Yep. So we have our head office at Kamuzu Central Hospital, which we call Lighthouse KCH. But we also have offices and staff in other central hospitals. Queen Elizabeth Central Hospital, we have an office with a good number of staff there. At Zomba Central Hospital, at Queen Elizabeth Central Hospital, we have what is known as the Umozi Family Center Clinic, which basically provides HIV services at Queen Elizabeth Central Hospital. In Zomba, at Zomba Central Hospital, we also have offices in the staff there, and we have a clinic which is called Tisungane Clinic, and this is the clinic that provides HIV services in Zomba. And then in Lilongwe, where our head office is, we also have a clinic which is just called Lighthouse Clinic, and we have quite a number of staff here. We also have Martin Cross Center Clinic. This is based at Bwaila Hospital. Okay. That's actually our biggest hospital. That's where we see the biggest number of clients. And then we also have Rainbow Clinic at Izuzu Central Hospital. So we have staff that are working there. So in all this, you may wish to know that Lighthouse is a well-known and recognized as the Center of Excellence by the World Health Organization.
Is it?
Yes, please. So
what makes it so?
Yeah. So we are very much pleased to be a Center of Excellence recognized by the World Health Organization in as far as provision of what we call continuum of care, because we do everything regarding HIV, starting with testing, providing treatment, but also monitoring the viral load to ensure that our clients who are put on treatment are actually responding well to the medication, which in medical terms is called the viral suppression. So we do that, and we provide high quality services to our clients, and that's why we are known as a Center of Excellence in HIV management.
Interesting, quite interesting the way you've shared the story, the background, and where we are now. Issues of HIV and AIDS, we have had issues of stigma, discrimination, those issues. Okay, top of the medication also that you're talking about. Share with us the story behind all of this. But firstly, about issues of stigma and discrimination. Where are we as a country with Lighthouse in it?
Yeah, so with Lighthouse in it, I would say we are doing quite all right.
Okay.
Because we are coming from a time when issues of stigma and discrimination because of HIV were so rampant in our country. But I think that was because of there were a lot of misconceptions and there were a lot of misinformation around HIV. And this is where we can get credit as institutions that are working on HIV, because we've tried to provide adequate information to dispel the myths around HIV. So what we see now is that more and more people are understanding. So once people have correct information, they understand what HIV is all about, that actually leads into less and less stigma. Of course, we may not celebrate and say we've completely dealt
that's
with the
where
issue.
I was coming
Exactly.
But are we on zero or
no.
still there?
We could still have cases, because people are different. Even if you tell them the right information, they can still choose to believe what they have always been be living. Yeah, but if I'm to compare with where we're coming from, I would say we have achieved a lot in terms of ensuring that the stigma and discrimination is minimized. But for us as Lighthouse, we've gone beyond that, because there are values that we have. We value confidentiality, we value dignity, we value equity. So we actually take the work that we do seriously, and therefore all our officers, especially those that come into contact with the clients, they fully understand that our role is to provide quality care and treat all our clients with dignity and with respect. So I would be surprised to get cases of such kind at Lighthouse. Yeah, but we treat such issues very seriously, and in fact, for us, it's a gross misconduct if any of our staff mistreats a client, or they do not respect and value the dignity of our clients. So that's who we are as Lighthouse.
In terms of medication, how have you achieved the issue of people coming here, getting medications? We understand it's also another thing that at least you have also made strides in terms of medication here. Share with us the story.
Yeah, so this is something that's very exciting, and again, relating to the issue of stigma that we talked about earlier on. Because of the quality services that we provide, our clients come to our facilities freely and get the medication. And as I said, because we try as much as possible to provide high quality care, we do assess each and every client. There are some clients who we call they are stable, and there are many of them, meaning they are living with HIV, they are on medication, but they are not having any problem in terms of any sickness. So those ones, we've put in measures that they come to our facility, they come straight and collect their medication and go. And of course, there would be some clients that might need to be seen by a clinician. But our standards are that when a client comes to our facility, they should not spend more than 20 minutes.
Really?
Yeah, they should be seen by a clinician or a nurse, and within 20 to 30 minutes they should be done, and they should be going to attend to other matters. But we also have community programs, and this is also another exciting area where a team of our officers actually go into the community to provide the services right there in the community. So they would engage the traditional leaders, they would engage the religious leaders, they would engage our clients themselves, and it's them that choose a place where they should meet and where they should be getting their treatment.
That's
and
exciting.
It's also a good program, and we are looking forward to expand this program because we've seen that it has quite a lot of benefits for our clients. You agree with me that not everyone is working, others find it hard even to get a 2,000 for transport to travel to our facility to get their medication. So we've taken it upon ourselves to reach out to our clients in the communities that they are staying, and this is proving to be a very exciting program, which is a very welcome program by most of our clients.
Interesting. Let's go for a break. We'll be back shortly. You're watching Phenomenal Being, and today we are with Safari Mbewe, who is the Executive Director of Lighthouse Malawi. Stay tuned. Welcome back. It's Phenomenal Being here on Rainbow Television, and today we are having Safari Mbewe, who is the Executive Director of Lighthouse Malawi, telling us more on the strides, challenges and success stories, and of course way forward in the Lighthouse Malawi. Stay tuned in. Welcome back.
Thank you.
Now, share with us the strides, the success stories that as Lighthouse you can be able to share and say, as Lighthouse, this is what we have achieved, this and this again.
Yeah, so thank you for that question.
Mm.
I'm pleased to inform you that as Lighthouse, we have achieved quite a lot. We've made significant strides in the contributing to the national HIV response. Earlier on, I talked about the high quality care that we provide. And I'm always proud to say if there is a place where people living with HIV can access high quality care, it is at Lighthouse and not anywhere else. So we pride ourselves in providing high quality care to people living with HIV, which we challenge that they may not be able to get it elsewhere. But apart from that, we are running the biggest HIV clinic.
Okay.
The Martin Health Center that I talked about, which is at Bwaila Hospital, is the biggest clinic the whole Malawi that provides HIV care. So you can imagine that if we are talking about having the largest clinic, then that clinic is Martin Health Center, which is at Bwaila Hospital, the one that is run by Lighthouse. To us, that is a great achievement. To date, we have clients that are over 35,000 live and on treatment. They are within our care as Lighthouse. So you can imagine that we are able to have that number of clients that we are seeing, that we are providing support. But I must also say that apart from service delivery, which is providing the service to people with HIV, Lighthouse is also providing what we call capacity building in the health sector. So we also have a role to train and build the capacity of different health cadres, be it the nurses, the clinicians, and even other cadres. So we train them, build their capacity, we mentor. Okay? So we also have a program where our staff, we have placed staff in government health facilities so that they could be mentoring our colleagues that are working in those sites, so that they could also be providing the high quality care that we are doing. So you can see that we are also contributing in the capacity building of the different cadres in the health sector. Apart from capacity building, we are also a well-known research institution. We do participate in research, we conduct research, where we do test a number of models. When we see that they are working, then we will present to the Ministry of Health. And to date, there are quite a number of models that have been piloted and tested at Lighthouse, which the Ministry of Health has adopted to be a national initiative. Yeah, so I could cite quite a number of examples. For instance, just a few weeks ago,
yes,
the Minister of Health was launching PrEP, pre-exposure prophylaxis. I would want to inform you that Lighthouse was behind the piloting and the research on the issues of PrEP. And when we were convinced that PrEP actually works, that's when with other partners, now government has adopted that through the Ministry of Health, and it will be used as one of the HIV preventive measures. Apart from that, we have also the type of testing which we call index testing. Now, the aim of this is to target our HIV testing to people who we know are exposed, or we have higher chances that when we test them, we will find them HIV positive.
Sure.
Yeah, so one of the initiatives that we have is when we have a client who tests HIV positive, then we will get their sexual contacts. We follow the normal ethical issues that are there. We follow that up until we also offer testing to those that have been exposed because of this client. And that has proven to be very effective. We call it yield, so that has brought in a high yield. So it's like you test a few, individuals, but you are able to get most of them that need to be put on treatment. So this is an initiative that was started by Lighthouse, and we shared with the Ministry of Health. Now it's being adopted to be part of the national initiative. So I could go on and on, but there are several initiatives that have been tried, tested, and proven at Lighthouse, and then shared with the Ministry of Health for such initiatives to be adopted at national level. So this is a great stride. So I've talked about service delivery, I've talked about the capacity building, and I've talked about the research that we conduct. So to me, these are very great strides that we have made as Lighthouse Trust.
Interesting. But looking at the strides, but maybe you have encountered, maybe in one way or the other, challenges while you are trying to improve your work. What are some of the challenges that you can share with us?
Yeah, so the major challenge for us has been the COVID-19 situation that we are in. Because if you look at some of the initiatives that I talked about, they require that our personnel interact with our clients very closely. And when COVID was at its peak, we had to suspend some of our programs, to suspend and reduce, because again the health of our staff is a priority, but also the health of our clients is also a priority. So that posed a challenge for us. It was actually a big challenge because we had a number of our staff that were actually infected with COVID. Most of our staff, they had relatives that they were infected with COVID. Fortunately, and we thank God for this, we never lost any staff due to COVID, and we thank God for that. But you can see that some of our services were interrupted. So this is what I would cite as what has been the major challenge. But of course, also the funding situation in general would have wanted to do more, but sometimes we get limited because we do not have all the resources that we require. Remember, it's a center of excellence. The service that needs to be provided is supposed to be high quality, so that would also require a lot of resources. And sometimes we have not managed to get all the resources that we need. So we have operated in a very resource-constrained environment, and that has been also one of the major challenges.
Finally, 5 years or 10 years from now, give us your focus, where you see Lighthouse and where you want it to be.
Yeah, so as I said, our focus is currently we are all in the central hospital providing high quality care. But this care that we are providing, we would want to see that people living with HIV can access the same care in other health facilities. Yeah, so basically 5 years from now, what we want to do is to continue with our capacity building program. So we should not just be proud that as Lighthouse we are providing high quality care, but we should be able to build the capacity of the personnel that are working in other facilities as well. So that even if that facility is not a Lighthouse facility, but people living with HIV that go into that facility should be able to get the same high quality care that they would have gotten if they had come to Lighthouse facility. So we'll continue with the capacity building program. We will continue with our expansion drive because there are a lot more people that we need to reach, which currently we are not reaching. So definitely we would want to expand our services and maintain, and if not even improving, the quality of the service that we are providing.
Any last words to Malawians out there?
Well, no, my last words is to assure Malawians and commit my institution to the work that we do. We are very committed to continue providing high quality services to people living with HIV, but also probably invite partners that have not started collaborating with us, because it's only when we collaborate that we can do more. I talked about operating in a resource constrained environment. There could be other partners out there that might want to partner with a Lighthouse,
Sure.
so that we continue doing the good work that we're doing, but also that they should be part of this success story. So I actually invite the partners and funders that have not started supporting us. If there is an institution where they can invest their resources for better results, then that institution is Lighthouse Trust.
Interesting. Thank you very much for granting us the time
You're welcome.
to have an interview with you.
Welcome, and thank you for this opportunity.
Thank you very much.
Thanks, Dan.
And that's all we had time for in the program Phenomenal Being. Today, we were having Safari Mbewe, the Executive Director of Lighthouse Malawi. I am Chimwemwe Kujaliwa. Bye-bye.